My name is Jeremy Edwards. I'm with GAINSWave. I'm here today with GAINSWave provider Dr. Robert Bowen in West Virginia. Dr. Bowen, thank you for being with us today. And if we can start off by telling us about your specialty and your practice, please, Doctor.
Okay, well, thanks, Jeremy, and thank you for inviting me. My practice, my training is internal medicine, anesthesia, critical care medicine, pulmonary medicine, sleep, cosmetic medicine and laser medicine, regenerative medicine, and wound and hyperbaric medicine. So I do a lot of different things. Some of those are university jobs, and the regenerative medicine, cosmetic medicine are part of my private practice, which is where GAINSWave fits in.
Thank you. And on the subject of GAINSWave, how did you hear about GAINSWave originally? How long has it been part of your practice?
Well, so we've been doing shockwave therapy in the wound center since, I don't know, 2008 or 2009. It's part of the protocol for people that have vascular ulcers. It can help or improve microvascular blood supply and help the wounds heal faster. So we've been using that for a long time, and I had a shockwave machine in my office as well that I used primarily on patients with athletic injuries. And when I heard about shockwave was being used for erectile dysfunction, it made perfect sense to me, because the mechanism is exactly the same as what we use it for in the wound center. And so I started doing some research, and I saw the literature primarily from Scandinavia in the urology literature for using this for erectile function, and did research online, and I found GAINSWave, and I believe I talked to you. It's probably been 3 years ago now. And said, when can I come down to Florida and learn how to do this?
Thank you so much. And you've been a member of GAINSWave for a number of years now. What features of the GAINSWave program, what aspects of the GAINSWave membership do you find most valuable?
Okay, well, so for me personally, I think the most valuable thing is the community, where we have a Facebook page where we can ask each other questions and reach out to people that are more experienced, or have you seen this particular problem? Have you seen a patient like this? What do you recommend? So those are the where we share tips and tricks. Has been the most helpful for me personally. Now the office staff has been pleased with the sales and marketing material and the support for the business aspects of it, which I'm not too involved with. But without that, there's nobody comes through the door to practice on.
I get it. Yeah, I'm glad that you mentioned the GAINSWave community. We probably have close to probably a little over 400 GAINSWave doctors now nationwide, and that Facebook group page is private to GAINSWave doctors and GAINSWave members, and it's a wonderful platform to collaborate peer-to-peer with other physicians, other doctors, other licensed healthcare professionals, and as you mentioned, talk about patients, talk about the patient intake, the encounters, talk about specific cases, and of course talk about sales, marketing, and operations. And just to turn back around to the patient, how have your patients responded to the GAINSWave treatment?
Yes, we've had very good outcomes. Now, before we were using GAINSWave in the practice, we were doing P-shot and O-shot. Been doing PRP, which is another thing commonly do in the wound center for healing, and so had been doing that for some years before we added shockwave, and now we've added bone marrow aspiration injections for erectile function as well. So we have lots of tools in the toolbox that we can use, and depending on the convenience for the patient, if patients live 3 hours away and they it's not so easy for them to come back and have 6 GAINSWave treatments. We may do less GAINSWaves and more PRP, for example. But what with GAINSWave by itself, consistently what we're getting is 4 to 5 points of improvement on the shim scale, which is enough to definitely make a difference. Now, some patients are more. It's the shim score is very important to help tailor what the proper dose of shockwave treatments or PRP, at least to give them an idea of, well, this is what your course is going to be. This is what the expected results are. And then, of course, depending on how they respond, we can modify that.
It sounds like you're adopting an approach that's individual and customizable to each specific patient, which I think is critical in this particular instance.
Yes, no doubt that that's true. And the other thing that we do is I have, and I didn't hire them specifically for this, but we're utilizing their skills. I have a psychiatric nurse and a psychiatric social worker have worked for me before, have continued to work for me, and they are involved with the regenerative medicine because, as we know, sexual function is not just a matter of blood supply. There's psychological components, there's relationship issues. And so we, because the treatment takes 20 minutes, we have, every time the patient has a shockwave treatment, they're also having counseling at the same time. And we found that that's highly effective. And sometimes we'll have patients come back and do counseling at other times. If there is a bigger issue, then in addition to their GAINSWave or their P-shot, we'll do relationship coaching or stress management and that type of thing as well.
That's an important approach. So you're not only helping your male patients with the issues between their legs, but also what's between their ears. It's both the mental and the physical.
Yes.
That's great. Is there a specific GAINSWave patient story, a specific case that stands out to you?
The one that stands out the most to me was a man that was in his early 70s, had his wife had died 10 or 12 years ago. Subsequently, he had prostate surgery and radiation, and really hadn't even thought about having an erection, since his wife died. And he had met a lady that they were interested in each other, and he came to me for advice. And with that history, I think his shim score was 8. And what I advised him to do was to consult with urology about an implant, because I was afraid that that even the combination of GAINSWave and PRP was going to be inadequate to give him a result. I expected his score would go up, but I didn't know if he would have enough of an erection to be able to use it. But he said that he'd already gone down that road and had decided not to have surgery, and he was all in for what we could do. And he had 12 GAINSWave treatments, 2 a week for 6 weeks, and a P shot. And his score improved from 8 to 15, and he was able to be sexually active again, even with all those comorbidities. So I was very pleasantly surprised by that. Now, since we're doing bone marrow aspirate, I probably would have done that if we'd had that technology available when he was a patient. We probably would have gone to that instead of the P-shot but it turns out that the P-shot was sufficient.
That's an incredible story. There does seem to be a synergistic relationship between GAINSWave and things like biologics, whether it's PRP, platelet-rich plasma, or exosomes, or stem cells, things along those lines. And I love that story. It seems that you helped this guy out, and he avoided having surgery, which is quite important for many patients out there. What would you tell a fellow doctor who's considering adding GAINSWave to their practice?
I would certainly encourage that. If you have a practice where you see male patients already, then this is a slam dunk. If you're have a cash-based practice, perhaps you're practicing cosmetic medicine and using PRP for vampire facial or something like this, then you have some of the skills already, and the GAINSWave treatments are highly effective. They are not difficult to do technically, but it is important to have training.
In terms of practice revenues, would you say that GAINSWave has had a positive impact on practice revenues?
Oh yes, no doubt, no doubt. And so it helps. The ROI is excellent, and the satisfaction, helping people. So there's you think, oh, it's a treatment for erectile dysfunction, so guys can have more fun, but that's only a small part of it. What this therapy does is it makes families stronger. And I think that it's important for families, it's important for communities, it's important for our country to have strong families. So this is, for me, it's more than the financial aspects are awesome, but that's not even the best part.